Murphy and the entire North Texas chapter of the ACS for giving me this opportunity to speak to you today. We're going to be discussing the quality and content of medical information that's available on YouTube. Excuse me. So over the last several decades, the internet has really become a primary source of medical information for both patients and their families, as well as for medical professionals. A decade ago, our group reported on the content and quality of information available on websites, and really found that the quality was generally lacking. Since that time, a variety of resources have been developed aimed at both lay population as well as for medical professionals, which has really done an excellent job of filling that gap. More recently, social networking sites have witnessed or have fostered the exponential growth of user-generated content. And we know that patients and their families have begun to use these resources as a way or as a means for self-expression and to communicate with others about their experiences. Even more recently, these resources are now being utilized by medical practice groups, hospitals, pharmaceutical companies, medical device companies, and even advocacy groups as a method of disseminating information in a way that a lot of patients and families find comfortable and familiar. With that in mind, we sought to examine the content and quality of videos that are posted on YouTube as they relate to selected pediatric surgical diagnoses. We searched YouTube for 4 pediatric surgical diagnoses. We specifically selected 2 congenital diagnoses, as well as 2 diagnoses that typically require a more elective treatment. So specifically the congenital diagnoses of diaphragmatic hernia and gastroschisis, and then in more usually older children, pediatric inguinal hernia and pectus excavatum. We evaluated the videos based on the owner type, as well as the intended audience. The videos were also reviewed by 2 pediatric surgeons who score them on a range of 0 to 2 based on their completeness, which included things like the etiology, pathophysiology, diagnosis, treatment, and the details of a surgical procedure, as well as accuracy. So gastroschisis had roughly 50% of videos created by medical professionals and 50% by lay population. Congenital diaphragmatic hernia was the topic that had the largest proportion of videos that were actually posted by the other category, and in particular for CDH, it was generated by one advocacy group in particular. It also had a really large number of videos that were created by medical professionals. In contrast, pediatric inguinal hernia had the largest proportion of videos created by medical professionals. These tended to be videos focused mostly on surgical technique. Pectus excavatum was almost the reverse in that it had the largest number of videos posted by lay people, and I think this actually reflects the fact that most children undergoing a pectus excavatum procedure, at least contemplating it, are of the age to actually post their own videos. So a number of these videos were actually posted by patients showing their own deformities, sharing support for each other, and actually sharing exercise techniques to try to disguise their deformity. Looking at the target audience, overall 80% of all videos on average were aimed at a lay population. The largest number of videos aimed at a medical population was videos focused on pediatric inguinal hernia, and again, these were videos mostly based on surgical technique. Looking at the completeness and accuracy overall, we felt that the majority of videos were neither very accurate nor very complete. In particular, congenital diaphragmatic hernia had a large number of videos that were fairly accurate, and again, I think this relates to the fact that a number of videos were posted by either a medical professional or by this one particular advocacy group. So a lot of the language between the videos from this one advocacy group was very similar. Despite the fact that a large number of the videos for pediatric inguinal hernia, or a relatively large proportion of the videos, were aimed at a medical population for inguinal hernias, the information contained was not very complete, and I think, again, it was because it was a medical technique video that didn't go into the details of the diagnosis. And pectus excavatum, I think, was neither accurate nor very complete for the exact opposite reason. Again, most of the videos were posted by usually the patients themselves. So in conclusion, we felt that the videos that are available on YouTube vary pretty widely based on their aim and quality, and that overall there was a paucity of videos that really contained accurate and complete information, something that a patient or their parents could really use in helping to guide their own discussions with their physician. We felt that the videos by medical professionals really varied widely also in their quality, and I think in large part that's because they had two very different aims. The videos by medical professionals for medical professionals were very accurate, but tended to be not as complete because they focused on a single area or a single focus of discussion, versus the videos by medical professionals for lay people tended to be extremely accurate and complete. So given the amount of information that's available on the internet, and particularly now on these social networking sites, we think it's pretty clear that people are turning to social websites like YouTube and others for medical information, as well as a forum for social support. We feel that it's important to meet the demand for more accurate and complete information by developing videos that are clear and structured. And that it also might be of benefit to label these videos in some manner so that the consumers are able to identify that these videos do contain information that's reliable and reliable and accurate. Lastly, we also think it's important that physicians take into consideration what is out there on the internet, because your patients are going to be seeing this, and this is, has the potential to significantly influence their own attitudes and expectations as you begin to discuss their diagnosis and treatment with them. So I'd like to thank you for this time.